Hello there, and a very warm welcome to our channel. My name is Maria, and I'm the owner and founder of the New Mummy Company here in Oakville, Ontario. And once again, we are joined by the delightful Dr. Dr. Vora, welcome.
Thank you.
So today we have a very interesting topic. Dr. Vora today is going to be discussing the top 12 products that you need for postpartum. So needless to say, I'm very excited to have this conversation with you. So Dr. Vora, would you give us a brief overview of who you are and where you are located?
Yep. So I am Dr. Vora. I am a chiropractor practicing out of the beautiful town of Milton. I have a passion for prenatal, postnatal care, as well as a little bit of pediatric care in terms of torticollis and tongue tie issues.
Wonderful. So we are delighted to have you back with us. And this, of course, is something that is very close to my heart in terms of giving parents a little bit more information when it comes to what they need and maybe a little bit of what they don't need when it comes to products for the postpartum period. So let's dive in. What is product number one?
So product number one, I'm going to go in sort of sections. So first thing, we'll start with everything in terms of breast care. So number one thing to pick up is nursing pads. So I'm not loyal to any of these brands. So any brand that is recommended to you or has great reviews, nursing pads are really great for if you're going to choose to breastfeed or even not choose to breastfeed, because if there is some leakage, you know, just to kind of tuck it into the bra and keep things dry. The other thing is if you do have any nipple trauma, this is another great way to keep things dry. And it's just, you know, something that postpartum moms need. So having a pack of these on hand is really great. So nursing pads. Moving on, and this is a good segue for nipple trauma. So one of my patients actually sort of gave me this tidbit. So eye masks that are shaped perfectly like nipples that are like gel pads. So stick these into the fridge, snip the middle part of it, so you've got two, and then you can just stick them in the fridge, and every time you're feeling a little bit of soreness in terms of nipple trauma and things like that, stick these into your bra or even just lay them on top. And now you've got some cool gel pads for any nipples that need a little bit of extra care at that time.
It's a great idea.
Yeah. And then these ones are really great. So these are basically round breast gel pads. You can use them hot and cold if I'm not wrong. Yes, you can. And so these are really great because they are shaped and they have a little bit of slit, so to give a little bit of space. And it's great for breastfeeding moms. And as well, as I said, even if you're not breastfeeding, if you feel a little bit of engorgement or things like that, just in that weaning phase, or even when you've stopped breastfeeding, this is really great to have. So any discomfort that you might be experiencing. So these are great to have on hand, including the gel pad. So whatever you need, according to size and according to issue, these are really great. Outside of that,
I think it's probably a good idea to notice the difference between the two, in the sense that, well, first of all, the iPads we probably won't heat because they're not designed to be heated.
Yep.
But the actual breast pads that can be heated, they have a space for the nipples. So they're not designed to go directly onto the nipple. They're designed more for milk in terms of comfort. So if you want to heat your breast, it'll help with the letdown. It will help with everything flowing when you're trying to feed or trying to pump. And then if you want to cool them, obviously the cooling sensation is very nice. But if you had been having engorgement, or if you were trying to reduce the amount of milk that you're producing, that's when you would go for the cold option.
Exactly. Yep. And then nipple cream. So this is really great to keep in the hospital bag, especially because a lot of my patients have commented that, you know, first few days were really traumatic in terms of their nipples. So nipple cream, and I've seen a bunch of great brands. I've seen some organic options. So definitely picking out what's appropriate. And so this I've seen quite a few people recommend to me in terms of patients. So nipple cream. All right, so now we've concluded all of the breast items. We're going to move down south. in terms of C-section moms who've had C-sections, vitamin E oil. So vitamin E oil is really good once you've got, enough clearance to sort of touch the area and sort of manipulate the skin a little bit. Vitamin E oil is great for scar tissue and just healing in general. But even vitamin E oil, you can use it for other things, skincare and all those kinds of things. So it's really good to have this on hand, a multi-use product. Aloe vera. So aloe vera, just as I was talking about the C-section, this is a great segue. So a lot of C-section moms do get a little bit of scar tissue where the incision was. And so this is a great way of just encouraging healing. Once it's okay to do so, you can definitely apply this and also use it with the vitamin E oil for the C-section scar massage. So this is really great. And the other thing that a lot of patients have told me about is Padsicles. So essentially Padsicles, from my understanding, is you take an overnight pad, a period pad, you apply some aloe vera on it, and then just stick it into the freezer. And then you have a bunch on hand. And so whenever you've given birth or anything like that, C-section or not, you can either use the period pad in your underwear for any, comfort or discomfort that you might be feeling. Sorry, any discomfort you might be feeling down there. And as well as I've heard of C-section moms using Padsicles on their scar tissue. So if there's any pain or anything like that, just laying the pad on top, using the underwear to just kind of hold it secure in place, just to give you a little bit of like comfort and cooling comfort. So aloe vera gel.
And we have the ready-made Padsicles.
Awesome. Yeah.
Yes.
Fantastic.
Yes.
Great.
Freedom Mom, who have a great range of products for mom and for baby. They have the Padsicles. They're called Icicle Pads, and they are ready-made for you. So when you purchase the box, it is quite heavy. But again, you don't have to put them in the freezer because they are the technology that's in them. You just basically crack them.
Even better. Yeah.
They will do it. So if you wanted to have them in the hospital with you, you're not looking for a freezer, so you don't have to wait until you come home.
That's fantastic. That's really great. I've never seen those, so that's awesome. Moving on, witch hazel. So one thing I do want to stress with this is no fragrance and no alcohol. So definitely trying to avoid any alcohol or fragrance-based products. So like anything without those things is great to get. This as well with the Padsicles, moms have been telling me that they basically put a little bit of this, the aloe vera gel, spray this on, put it in the freezer. This is also great because it does have a spray end to it. So you can just spray a little bit down there. And so these two are really great for healing and things like that postpartum. Now, some moms, unfortunately, will experience hemorrhoids. So things like hemorrhoid cream. So two things to get is an ointment to help soothe and things like that. I should hold it the right way up. So an ointment to hold, soothe things and things like that down there, as well as some cleansing pads. So these are really great. They just come in a little container. And so these are to help with any sort of pain with hemorrhoids or anything like that. And then speaking of Freedom Mom, I have one product, and that is the upside down Peri bottle. And so a lot of first-time moms have told me about the fantastic journey that was the first-time use of the washroom. And so this, I've been told multiple times, this as well as the nursing pads have been key in everyone's list. But the upside down Peri bottle is great because you can use this to just, cleanse down there once you've used the washroom. I've had some moms just put cool water on it. So it's for soothing and things like that once the washroom is being used. So this is really good. And
yes, they are absolutely wonderful.
So diapers, I understand diapers are for babies, but the first week, diapers can be for moms too. So underwear, in terms of adult underwear, these ones are really great because you can basically strap them on and strap them off. So there's no bending down involved to pull things up and pull things off. So these are really great. I actually had given some to a friend of mine, and she actually had a cesarean section. So it was really hard for her to pull them on and pull them off. So then when, she gave me a little bit of a feedback, I guess, she said, yeah, definitely something that you can tear off and just throw off and something you can clip back on. So those are really great for basically first week healing and things like that. I've had some patients tell me they've actually even used them as a Padsicles. So they've just like sprayed the aloe vera gel and the witch hazel on them, stuck them in the freezer. And so when they came home, they could just pull them on and pull them off. And so that's really great. Now, although I recommend eating a full meal, one thing that another patient did bring up that was really great is these. So these are basically meal replacements. These are high in protein. But she said, whenever she was like breastfeeding, got really hungry and she knew that she'd have to be sitting for a little bit, she had these on hand with a little bit of a straw. And so what she would do is just drink a little bit, satisfy a little bit of her hunger in that moment, stick it into the fridge, and then eat a full meal. And then the next time she was breastfeeding, if she needed a little bit, she would have this handy again. And so basically, these are really good on the go. I do encourage you to eat a full meal, but
Yes.
if need be, these are great to have handy, even in the hospital. So if, hubby or yourself are feeling hungry and you don't have anything, or time, I should say, this is really great to just have on hand. So just a meal replacement drink. Don't make this your meals every day, but something to have on hand as adjunct. And I think I've exhausted my list now. So those are all 12.
Wow, I think you've really hit on some of the most important key products that people may not have considered. In terms of planning for your postpartum, is there any of these products that are in there that maybe you should get clearance on or should speak to your doctor about or your midwife about first?
Yeah.
Do any of those fall into that category in terms of disclaimers?
So one of the biggest things I would definitely say is anything that you apply topically. So the vitamin E oil, the hemorrhoid ointment, the aloe vera, and the witch hazel, always good idea to just make sure that one, it's okay for you to use, and when is it okay to use. Most postpartum moms, once they get the clearance in terms of their 6 to 8 week clearance and everything looks healed, they can start using these products. So that's a good general, idea of when to start using these. But I would always say, for sure, ask, is this okay for me to use? When should I start using it? So you have a little more advice in that section.
Of course, because the vitamin E oil is going directly onto the scar tissue to help with the reduction of the scar tissue. So we don't want to start too early, but obviously we want to make sure that if we do have a scar, that we can do what we can to minimize it. Not that it's something to be minimized or forgotten about, because it's obviously a very important scar. But for those who want to make sure that the healing takes place appropriately, does the massage aspect help in addition to the vitamin E oil, or is it just the vitamin E oil?
So the scar massage plays a few roles. One of the things with scar tissue especially is that people used to think that the scar tissue is laid down horizontally or parallel to the skin, but there is research to show that it actually also grows inward. So in terms of things like gripping onto other tissues or muscles underneath, there is some evidence for it, although not strong, there is some evidence for it. So one of the things scar tissue does is sort of break up just some of those sort of adhesions is what we would call them. And so it does play a really big role in just like tissue mechanics and just making sure that things are more malleable and easy to move. The other thing is, just like we stretch our muscles and things like that, we don't really think about this, but obviously we are stretching our skin at the same time when we do these types of things. And so by mechanically speaking, just giving the skin that sort of torsion and tension allows for a little bit of flexibility in the tissue that now is not as flexible because there is a scar there. And so it's important in terms of, doing the scar tissue massage with guidance first, and then, doing them at home and making sure that the skin is malleable for things like moving, picking up baby, exercising, day-to-day life. But also outside of that, just preventing the scar from being completely stiff, because that can present with a little bit of soreness.
Okay, wonderful. When it comes to applying the cream as a hemorrhoid cream or applying the vitamin E oil, what steps should somebody take? Do we get somebody to apply them for us? Should we be wearing gloves? Like how should we go about putting on these products?
So, I guess wound care 101, making sure that the area that you want to apply these creams on, it's clean, making sure the person or yourself applying it is clean in terms of washing their hands, and then also following the directions on the box. If you are needing more advice in terms of applying different products together, for sure, seek advice of a midwife, a pharmacist, or a medical doctor to see if there would be any reactions. Say, for example, the vitamin E cream and the aloe vera and the witch hazel. If there's any interactions, you should know about that. And then especially with areas like the down below is putting it very nicely, making sure that like there's someone who's monitoring it in terms of either yourself with the mirror or even your partner, to see if there's anything that looks a bit odd, right? Like if there is some sort of ooze or anything like that, definitely bringing that attention to your medical doctor and stopping the use of these ointments, right? So until you definitely know that things are okay, stop using them. And also make sure before you begin using them, right, make sure that your doctor has given you clearance and how to do it as well. So I always say, read the label on the box, seek the advice of a pharmacist or the midwife or a healthcare practitioner.
And for things like the vitamin E oil, how long should you be massaging for? Do you do it, and how often should you do it? Should you do it more than once a day? Do you need to do it every day for a month, a year? What sort of would be the recommended guidelines for putting that on?
So I actually say at least in terms of consistent for a month after clearance. The reason being is that's when you're healing the most, and that's when things are sort of relearning, the forces of picking up a baby, forces of breathing, and all those laughing, sneezing, coughing. So all of those things definitely are happening once in the first month, and that's critical. And then after that, just periodically, right? Once a month, twice a month. For some women, the scar tissue tends to be a bit stronger on themselves, and you usually know that, when I scar really bad. And so for women who do experience that kind of scar tissue, definitely just kind of keeping up a little more. It doesn't have to be every day, but definitely every week for the first month, and then, cutting down according to how you feel things are moving. And things will change. Sometimes you might feel a bit stiffer. Sometimes you might feel a little more malleable. So when you feel a bit stiffer, maybe, ramping it up again, and then slowing it back down once you feel like the tissue has changed. The other thing is, if you take on a physical activity that, for example, yoga, especially with back bends and things like that, if you start to feel a little bit of pulling, maybe starting a little bit of massage again around the scar is not a bad idea.
Okay. And when it comes to getting the all clear from your doctor or your midwife, and starting to, get back to a little bit of more normal activity, are you likely to then still feel that sort of tenderness, and what should you be looking out for?
So one of the things is, a lot of my patients have, especially postpartum, many years, 3 to 5 years. These are moms who've been, at least from the last birth, quite a bit out. They do still feel a little bit of tenderness. I've heard of sensations such as burning, depending on the activity they're doing. So yoga back bends is a big one that I hear about. Pilates is another one that I hear about. And so they might feel a little bit of burning, stinging, but not in the sense that once they cease the activity, it's still there. I think as a chiropractor, if my patient told me, I'm still feeling burning and stinging, even though I did Pilates a week ago, that would prompt me to definitely get them to see their medical doctor and make sure that everything is okay. Normally things are okay. It's just that, adopting a new activity might challenge the scar and the tissues in a different way. And so just monitoring, keeping an eye on it. And then outside of that, if there is any sort of ooze or any bump or anything that you notice that is not normal, in the sense of like if your scar has healed, everything has been going okay, and then now you've noticed a bump or an ooze or something like that, for sure seek out some attention either from a midwife or a medical doctor, to make sure that things have healed properly and that's not something that's new.
Okay. And if somebody had stitches, so maybe they either had a tear or an episiotomy, would the same apply in terms of the care of that wound?
Yes, 100%. Making sure that once you get your clearance, monitoring it at least, once a month postpartum. I would say until 6 months, just to make sure things are clean and things are healing okay. Usually the first month is when the tissue is healing the most. And I say that with air quotes because it's different for everybody and different for everyone's lifestyle. So definitely making sure everything is okay and healing. If there's a new pain, a change in intensity of the pain, a change in frequency of the pain, these are things to look out for. So if there's any change, always bring that to your doctor's attention. And then also just, getting to know your body as well. So I encourage patients definitely use a mirror, check things out yourself, because number one person to sort of notice these changes is you or your partner. And so make sure that, you're keeping an eye on things in the shower or, in bed, and making sure that things are looking pretty good and healed.
And while that healing is continuing, then maintaining the use of the upside down Peri bottle.
Yeah.
To help reduce the stinging from your urine by diluting it with that warm water will really go a long way towards making you feel a lot better. And of course, if you need to use your Tylenol or whatever pain relief that your doctor has prescribed for you, then don't be a martyr and do use it.
Yes, definitely. So I do recommend do whatever makes you feel comfortable and do whatever is, safe in the sense of if your doctor says it's okay to take a little bit of Tylenol, take the Tylenol.
Yes, absolutely. Absolutely. But obviously with any pain medication, it can cause constipation. And so if you have had stitches or a C-section or hemorrhoids, then you're going to want to avoid any of that backup situation. So make sure that you are monitoring your fluid intake and your fiber intake, because the last thing you want to do is be pushing down there. So make sure that that doesn't become another issue or another problem for you by making sure, first and foremost, that you're just staying hydrated. But if you're pumping or breastfeeding, you're going to be taking lots of fluid on board anyway.
Yeah.
Wonderful. Well, once again, Dr. Vora, thank you so much for joining us.
Thanks for having me.
Thank you for joining us. I hope that you have found our video today very, very helpful. If you would like to connect with Dr. Vora online, please give us your socials.
So my Instagram is at Dr. Vora. So that's dr.kvora. And my Facebook is Dr. Vora. You can just search it out and you will find me. And LinkedIn, the same name, Dr. Vora.
Wonderful. So please do follow Dr. Vora on her socials. You can also connect with us on our social media. And we would love to hear what products worked for you in the postpartum period. Was there a product that you didn't know about today? Was there a product that you used that we didn't mention? Please let us know. We would love to know your thoughts. If you found today's video helpful, do give us that thumbs up. It's always great to know that you give us that positive feedback. Those positive vibes, they're always good. And of course, we would love to have you join us on this journey. So please do hit the subscribe button so that you get notified of all of our new videos as they are released every Thursday. So until the next time, thank you again, Dr. Vora, and we will all see you very soon. Take care. Bye-bye.
Bye.